Welcome to InsuranceWorldTV, your go-to channel for all things insurance. Here, we dive deep into the questions that matter most to you and bring clarity to the topics that impact your life. Today, we are tackling a topic that's on everyone's radar. That is Mpox. We will seek to answer these questions. What exactly is this disease? Where did it come from? How does it spread? What are the symptoms? How is it diagnosed? What are the treatment options? And most importantly, if you or a loved one were to be affected, would your medical insurance have you covered? Stick around as we break down everything you need to know about Mpox, from its origins and symptoms to diagnosis, treatment, and the all-important insurance question. So, let's begin. Question 1. What is Mpox? Mpox, formerly known as Monkeypox, is a viral infection caused by the Monkeypox virus, which is part of the orthopox virus genus. It primarily occurs in Central and West Africa but has been reported in various regions globally, particularly during outbreaks. Question 2. Where did this disease come from? It was first identified in 1958 in monkeys used for research, hence the name monkeypox, later Mpox, and the first human cases were reported in the Democratic Republic of the Congo in 1970. Question 3. How does it spread? The disease can be transmitted to humans from animals, such as rodents or primates, and can also spread from person to person through respiratory droplets, bodily fluids, or contaminated materials. Mpox is spread through close contact, human to human, or animal to human contact. Respiratory droplets. Eating inadequately cooked meat and other animal products of infected animals is a possible risk factor. Sexual transmission. Some early reports have posted that this is a possible route. The major route is physical contact and respiratory droplets, much like COVID. In other words, what we are talking about here is close contact. It's not a situation where if you casually pass someone in the supermarket you get it. Question 4. What are the symptoms of the Mpox disease? Symptoms typically appear 5 to 21 days after exposure and can include fever, chills, headache, muscle aches, fatigue, swollen lymph nodes, a rash that can progress from flat lesions to raised bumps filled with fluid. The rash often progresses through various stages, including macules, papules, vesicles, pustules, and scabs. Question 5. How do we treat it? There is no specific treatment for Mpox, however, antiviral medications, such as tecovirimat, may be used in severe cases. Supportive care is important for managing symptoms. Treatment for Mpox primarily focuses on alleviating symptoms and supporting the body's recovery, as there is no specific cure for the virus. However, in certain cases, antiviral medications may be administered. Treatment options. Supportive care. Symptom management. Patients are typically treated with medications to reduce fever, pain, and itching. Rest, fluids, and proper nutrition are also crucial to help the body fight the infection. Skin care. Keeping the skin clean and dry is important, and in some cases, topical treatments may be used to soothe lesions and prevent secondary bacterial infections. Antiviral medications. Tecovirimat, Pox. This antiviral drug, originally developed for smallpox, may be prescribed for severe cases of Mpox or in patients with compromised immune systems. Tecovirimat works by inhibiting the virus's ability to spread within the body. Cidofovir and brincidofovir. These antivirals, also used to treat smallpox, might be considered in certain situations, though their use for Mpox is less common. Isolation and infection control. To prevent the spread of Mpox, patients are often isolated until the lesions have crusted over and fallen off. This helps protect others, especially in healthcare settings. Monitoring and complication management. Patients should be monitored for potential complications, such as bacterial infections, respiratory issues, or dehydration, and treated accordingly. While there's no cure for Mpox, with proper medical care, most people recover fully. Keep optimal nutritional status with balanced meals. Other medicines to treat the symptoms. Smallpox vaccination is also effective in preventing Mpox. Older people, 40 years and above, who got this vaccine before it was globally eradicated are therefore fortunate. 6. How can you protect yourself? The good news is that the standard public health guidelines for COVID prevention measures also apply to Mpox. Wash hands regularly with soap and water. Avoid close contact with infected individuals with conditions as above. Use PPE when caring for someone with a condition. Question 7. Does health insurance cover it? Whether Mpox is covered by medical insurance depends on the specific terms of your health insurance policy. Here's what you need to know. 1. Coverage for infectious diseases. Most standard health insurance policies cover the diagnosis and treatment of infectious diseases, including hospital stays, doctor visits, and prescribed medications. Mpox, being an infectious disease, would generally fall under this category. 2. Hospitalization and treatment. If Mpox leads to severe symptoms that require hospitalization, your policy should cover the associated costs, such as room charges, medical procedures, and any antiviral medications prescribed, like tecovirimat. 3. Outpatient care. If you're treated on an outpatient basis, including visits to a doctor for diagnosis, lab tests, and supportive care like fever management or skin treatments, these expenses would typically be covered. 4. Exclusions and limitations. It's essential to review your policy for any exclusions related to pandemics or specific diseases. Some policies may have restrictions or waiting periods for coverage related to newly emerging diseases. 5. Preventive measures. In some cases, insurance might cover preventive measures like vaccinations if one is developed or recommended, particularly for those at high risk. 6. Travel insurance. If you contract Mpox while traveling, your travel insurance may cover emergency medical expenses. However, this also depends on whether the disease was known in the region at the time of your travel and any exclusions in the policy. 7. Public health considerations. During widespread outbreaks, government programs or public health insurance schemes might step in to cover treatment, especially if Mpox is declared a public health emergency. To be sure of your coverage, it's wise to contact your insurance provider directly and discuss the specifics of your policy. They can give you detailed information on what's covered, any exclusions, and the process for filing a claim if needed. Conclusion. Outbreaks of Mpox have occurred sporadically, and vaccination against smallpox has been shown to offer some protection against Mpox. If you need more details or have specific questions about the disease, feel free to ask. We trust this video has been of value to you. Thanks for watching. Don't forget to hit that subscribe button, give us a like, share this video with others, and drop a comment below. We'd love to hear your thoughts. See you in the next one.